10 tonight. Over the past decade, major medical advances have been made in the world of genetic testing, and local doctors say finding answers now can help save lives in the future. NBC 26's Haley Tempest explains how genetic testing helped one Northeast Wisconsin family in tonight's NBC 26 special assignment.
Local healthcare professionals say the genetic testing field is consistently improving. One local woman shares why she went through the process for her family.
Tara and her husband are counting down the days.
I am about 8 months along.
But the road to this pregnancy wasn't an easy one.
Last year I had found out that I was pregnant with our third child, and we had complications with the pregnancy pretty early on. So we went in and had an ultrasound done. When we went back, we were told that within that time frame I had miscarried.
After their loss, Tara and her husband were offered the opportunity to have genetic testing done.
I didn't think that it was something that would be within the realm of, a normal person to be able to do.
Genetic counselors see stories like Tara's every day.
We're all at risk for something. Most of us just don't know what it is.
Shenna Beck is a senior genetic counselor with Aurora Baycare.
Translating the medical information to a point where people can understand and use it for their health care and make educated decisions.
Genetic testing can be done during pregnancy, but also to determine a person's chance of developing or passing on a genetic disorder. Dr. Peter Johnson's patients have genetic testing done to find out if they're carriers for things like ovarian cancer.
When it's first offered, people are like, why? I don't really want to know these things. I see a lot of women in the market that when it's presented to them with the fact that this is going to help you, this could potentially help your family, that there's very few that refuse it.
Tara was nervous to find answers, but after being tested, she and her husband found out they weren't carriers of the defect that caused her miscarriage.
It wouldn't have only affected us. We could have passed that down to our daughters, and it could have affected their future pregnancies as well.
Experts say over the past 10 years, answers have been easier to find for families.
We are just skimming the surface. We're getting into the era of personalized medicine where, based on the genetic makeup, we can tailor the therapy.
Tara's test results led them to trying to get pregnant again, and their baby girl will arrive in August.
I just don't think that I would have been able to handle multiple losses before finding out answers, so I was definitely very grateful to have that opportunity.
A conversation with your healthcare provider is the first step for genetic testing, and doctors say it's important to be up to date on your family's medical history. Haley Tempest, NBC 26.